All right. Again, good morning, and thank you all for being here with us today. We are very excited to host a Learn series session today on organizational wellness strategies for employers and employees. We want to give a huge thank you to our sponsor, Tompkins Trust Company, for making yet another Learn webinar available. We're very fortunate to have Dr. L.E.A.R.N. Executive Director of the Mindwell Center, and Dr. Jeffrey Moore, former chair of Preventative Medicine and Family Health for the Committee of Medical Society of the State of New York. They'll be guiding us through a discussion today on the topic of organizational wellness strategies. And I do just want to say again, for our attendees here in person, feel free to post any questions that you may have in the chat. We will have time for Q&A at the end for both of our panelists. And I would like to now welcome the gentlemen to introduce themselves and give a little bit about what brings their background and what brings them here today. We'll go in alphabetical order and turn it over to Dr. Rakow to go first. Aaron.
Thank you. And thanks for being here, folks. It should be a nice conversation this afternoon. Again, my name is L.E.A.R.N. Rakow. I am the Executive Director of the Mindwell Center. We're an outpatient mental health organization located here in Ithaca on Ithaca South Hill across from Ithaca College, looking out the window now at that. We also have a second location in Albany, New York. I'm also professor of clinical psychiatry at Georgetown University, where I've had a position and worked for about 10 years in largely school-based mental health. But increasingly with my work at Mindwell now, we're doing both traditional outpatient mental health care as well as providing support for organizations such as many of those that you may be representing today. So very excited to have a conversation with you, and I'll turn it over to Dr. Moore.
Yeah, so thank you, David, and good to see you again, Aaron. I'm Jeff Moore. I'm the past president of the Tompkins County Medical Society. And as David said, chaired the Preventive Medicine and Family Health Issues Committee for the State Medical Society here in New York for 7 years. And my interest and expertise is really in issues around lifestyle medicine, as well as implementing health improvement and chronic disease management for patients with chronic diseases and disabilities. That's been my longstanding interest. And once you start going in those areas, then you develop some expertise in what's known as social determinants of health. So today I'm going to be speaking with you about those things.
Thank you, Dr. Moore. So, we at this point have, about 9 people here today. I think this is a small enough number for us to just go around and actually ask you all if you would feel so bold as to introduce yourselves. We would love to be able to know what your name is, more importantly, who or what organization you represent, or what brings you here today, what your interest in this topic is. Now, I can't see all of your names. So David, could you potentially help me with this? And I don't know if you can see names.
Yeah, I can. I'll be more than happy to do this.
You.
I'll go in order based on how my screen orients everybody. So the first person I have up is, and forgive me if I get anyone's names wrong, Kenneth Subin.
You nailed it. Perfect.
Awesome. Thanks for being
here. Good afternoon. Thanks for holding the seminar. I do appreciate it. So I'm a physician here in Ithaca. I'm the Chief Medical Officer for Cayuga Medical Associates, and currently pursuing additional board certification in with the American Board of Lifestyle Medicine. So I have a very strong interest in lifestyle medicine issues, and currently starting to look at the burnout issue amongst our providers. And so I'm very interested in initiating not only a provider, but an employee wellness program, more formalized one for our staff. So I have lots of interest in starting from the beginning, because we don't really have anything currently. So I'm starting from scratch. So get basically in the data gathering collection phase of the development of this program, this initiative for our organization.
Awesome. Thank you for being here, Kenneth.
Yeah, thank you.
Next on my screen, I have Heidi Sherwood.
Hi, I am from Park Foundation, and I'm here just to learn about how employee wellness can be had within the office, and different views on that.
Great, thank you.
Awesome. Thanks for being here, Heidi. Next up, I have Jordan Herson.
Hi, I'm Jordan Herson. I work with Visit Ithaca and the Chamber, and I was just interested in this L.E.A.R.N series, so I joined last minute.
Thank you. Last minute's good.
Thanks for being here, Jordan. And I don't see the last person here has a mic. Jim, are you here? Can you, I think they may just be observing. Yeah, okay. All right, cool. So I think that's everyone. We had Chrissy pop off, but she may have been having some technical difficulties, so she'll probably be back on in a bit. But I am ready to turn things back over to you again. I just want to say one more time, though, thank you all for being here today. It is going to be a really good discussion, and I'm going to turn things over now to Dr. Ray Cowell again to get us started.
Thank you, David. And everyone, this is going to be a toe in the water approach today, so we're very interested in having a larger conversation with all of you. If there are additional questions that come up, we'll both be providing our information to you, and David, of course, can help you get in touch with us as well if there are questions that you'd like to have answered beyond what we talk about today. To orient you, we're going to each spend, Dr. Moore and I, about 15 minutes or so talking about some topics at a relatively high level, and then turning it over to a conversation with all of you and some Q&A around this very relevant topic of mental health and the impact of COVID on mental health within the workplace, and also lifestyle health, as Dr. Moore mentioned in his introduction as well. So specifically for me, I'm going to be speaking about the pre-pandemic mental health outlook today, as well as the impact of COVID-19, some emerging data that we have in that capacity in terms of what it's done to our society and our workforce and others. What you can do about this as a leader in your organization or as a member of your team, and ultimately how you can get help. I am very comfortable with people interjecting and asking me questions as we go, so please feel free to do that. According to SAMHSA, to begin with, in a behavioral workforce report that was published earlier this year, for the first time we're seeing it scale, and we're actually having a conversation about mental health because of the nearly 60% of those surveyed reporting a mental health need and not receiving it, treatment that is, in the US currently. So if there's a silver lining to what we're going through right now, it is that this has become much more a part of our pop culture conversation, much more a part of our dinner table conversation, water cooler conversation, virtually or otherwise, which is great. I think in all of our lifetimes, the discussion around mental illness and how to support mental health and well-being has become common, has become accepted. It's less stigmatized than ever. So we have seen, obviously, a tremendous impact from COVID-19 in terms of loss of life and economic issues across the globe. Those are things that we are still working to climb out of. But I do want to begin this entire conversation today, I think, with an optimistic view that we are going to hopefully have more of an openness to a discussion around mental health and well-being in our country and our society moving forward. But to talk about what we know about the impact of COVID-19 is, what we have seen, and not surprisingly, is that rates of mental health have skyrocketed. In fact, about 4 in 10 adults in the US reported symptoms of anxiety or depression. And that is a trend that is increasing by the day, and is really up from around 1 in 10 adults who reported these same levels of mental health needs from January to June of 2019, prior to the pandemic beginning. And indeed, a recent Kaiser Family Foundation health tracking poll from last winter found that many adults are reporting specific negative impacts on their mental health and well-being, as you can see here, from everything from sleeping difficulties to, in some significant cases, serious thoughts of suicide risk within the past 30 days. And while we are seeing that things are improving somewhat, especially as we're seeing options for pediatric vaccinations and the impact of the Delta variant decreasing a bit, the toll of the pandemic is deep, as we know, and ongoing and necessary public health measures that expose many people to experiencing situations linked to poor mental health outcomes, such as isolation and job loss, continue. As you can see here, the rates of anxiety and depression from January to June of 2019 compared to January of 21 are nearly 4 times the rate that we would have expected to see before the pandemic. And as you can see here, amongst both essential and non-essential workers, with the rates of anxiety, depression, substance use, and thoughts of suicide, as you see from the left to the right of your slide here, being 2 to 3 times higher than prior to the pandemic. So to look deeper into these data, we find that throughout the pandemic, anxiety, depression, sleep disorders, thoughts of suicide have increased, and who have also, the individuals who have experienced a number of pandemic-related consequences, such as closures of institutions of higher education, transitions to remote work, loss of income or employment, that additionally, as major life factors, have contributed to poor mental health. And so what we're looking at here is ultimately 1 in 2 young adults in particular, when we're looking at these data, are reporting symptoms of anxiety and depression, with just under 1 in 2 adults ages 25 to 49 reporting the same thing. Extremely high rates of mental illness within our society is the point that I'm trying to make. And just to make a final point on this, in addition to the increases in anxiety and depression, job loss may also lead to other obviously adverse mental health outcomes, such as substance use disorder and other things. And during the previous recession, back about 12 years ago, the high unemployment rate was also associated with increases in suicide. And so as you can see here, the same KFF health tracking poll that I cited earlier found that people with lower incomes are generally likely to report the largest major negative mental health impacts from worry or stress over the coronavirus. So as with many things, those with the least in our society have had the largest impact, as I'm sure many of you here today have noticed in your places of work and in those circles that you associate with here locally. So I want to speak very briefly to a topic that is near and dear to my heart, that I would like to be able to impart a little bit of knowledge to you all today around, which is the topic of task shifting. Thinking about how individuals such as each of you and the organizations that you represent could actually hold the key to being able to delegate and support a more comprehensive mental health support structure, because quite frankly, we do not have enough mental health professionals. It should not come as a surprise to anyone in our society to be able to handle the immense need associated with the data that I've just very quickly gone through with you. And so what task shifting is, as you can see here, is essentially a process of delegation, which involves shifting tasks, such as in many cases, the delivery of certain psychological interventions, not all, but certain psychological interventions for mental health conditions, from highly qualified health workers to workers with fewer qualifications and minimal training. And the idea here is that a lot of these ideas, a lot of these interventions do not take a PhD or an MD to be able to effectively implement, and can be implemented by individuals with relatively minor training, which we do, which a lot of organizations do in our community. The idea here is to increase that coverage of mental health care and to use resources that are so limited as effectively as possible. So essentially, in this case, a single HR representative from an organization or a mental health clinician could train an entire group of individuals at scale in workplace well-being to also help them effectively assess and begin to intervene. So we're contacted quite frequently by organizations in the community thinking about how we can do this. the first thing that we always focus on is thinking about what data are required to first do a needs assessment of your organization and where those needs may be. We partner with a company called Mira at Mindwell, which helps us be able to track what's called behavioral health data, or create a measurement-based care system so that we're able to effectively measure outcomes amongst the various things that we're doing with organizations in the community. But this is something that organizations such as those that you represent may already be doing or could be doing even more effectively to leverage what limited resources you have, and then pinpoint what those data are telling you, pinpoint services and resources to those areas of highest need through a task shifting model. So one of the things that I always like to talk about and would love to spend some time talking about this afternoon with you all after you hear from Dr. Moore is, what have you tried? What would you like to try within your place of work to support the mental health needs of yourself and your teams? We heard one individual earlier today saying, interested in employee wellness as an organization, how we take better care of our employees at Hugo Med. That's a really important topic for us all to be thinking about, and something that we're seeing, again, going back to the beginning of this conversation, we're having more and more now than probably ever before because of the fact that it's so in our face these days. The task shifting element of this conversation and the what can you do about this element of the conversation is not a complex one. When we're talking about what you can do, we're talking about things that in many cases you're probably already trying. Flexible work-life balance schedules, really living up to those, not just giving lip service to them, but truly being as flexible as we can, knowing that COVID has caused so many changes in the workforce needs. And we know that our workforce are now handling and juggling so many different things in their time outside of work. How do we more effectively provide that flexibility and work-life balance as an organization? Also thinking about what types of services we could embed within the organization: on-site counseling, group-based support, employee assistance programs that aren't just saying we're an EAP, but we know no one really uses this, because a lot of EAP programs have about a, nationally, I should say, about a 5% utilization rate, largely because a lot of organizations will use them, but they don't have a hyper-localized approach. Individual employees who may benefit from those services are only utilizing them at 5% uptick because of the fact that I think in many cases they're viewed as an extension of an HR department's potential surveillance over the health and well-being of an employee. And so we really try, at least at Mindwell, to create relationships with organizations as a community-based partner to help with an EAP that has a much higher rate of utilization. And we do that through a variety of things that we can talk about. But thinking about what your EAP looks like and how you can more effectively promote that and enhance it. From an enhanced benefit perspective, also, there are lots of things I'm sure that we've been thinking about as organizations, everything from providing emergency financial assistance to providing elements around expanded health life or wellness benefits in the workplace. And there are some really exciting examples of that I hear about weekly and would love to take some time this afternoon hearing from all of you on as well. And then finally, thinking about how management communicates and trains their managers to provide this level of support when individual employees do come to them, providing also periodic health and wellness updates and initiatives that boost morale, given that we are looking right now at a workforce that is fatigued and tired, especially within many of the areas represented on our call today, that could use additional support, and how we can become innovative in doing that. So I want to be respectful of time, and I know I'm flying through a lot here in a relatively limited amount of time, and hope that we can have a much deeper conversation on this in a few minutes. But I just want to close with an example of one model that we have found to be very successful in working with organizations in our region. And it focuses on a 3-tiered system. So as you see here at the bottom of your slide, Tier 1 is looking at promoting safe and healthy work environments, some of the things that we've just been talking about. So this could help with providing customized wellness seminars for an organization. things that you as a member of your organization may want additional access to, but are looking at where that could potentially come from. You can partner with a variety of different organizations in the region that have a lot of content expertise, or maybe your organization has that expertise within it. And it's just a matter of saying, is there a way to create some type of a wellness seminar series so that all of our employees are able to come to that on a regular basis? Maybe it's monthly or maybe it's bi-monthly, and can take advantage of it. One of the things we do is our clinicians that are providing interventional support at the tier 3 level of this model are the ones that also deliver these wellness seminars. And so it provides an opportunity for employees to say, if I'm interested in working with Dr. Smith and I'm hearing Dr. Smith talk about insomnia, which is something that I'm dealing with currently in my life, I would be that much more likely to engage with Dr. Smith and to tell my employer I'd like to make an appointment with him or her than if I didn't have that personal connection with them moving in. So it's a way, again, of destigmatizing and making the entire scenario of engagement in mental health feel more relevant, kicking the tires a bit on the individual that you may be working with. At the tier 2 level, we like to encourage employers and folks to think about what are the areas for early identification of staff at risk. We talked a little bit about how to conduct a quick needs assessment. This is something that there are some great measurement tools that are empirically supported to work very effectively for assessing workplace health and overall well-being. This is something that we typically do as a standard course of our work with organizations, but there are a lot of free resources out there as well. And I'm happy to connect you with those resources if you're interested in learning more about them. To do a quick needs assessment on your organization is a really important first step in a lot of this, to understand where those needs are and how we can effectively allocate limited resources to support this. But we also, at the tier 2 level, oftentimes will think about how we can better support employees and, more importantly, their management teams to be able to provide some of that task shifting support. So how do we support managers to become better listeners, validators, communicators, and actually deliver interventions on behalf of their employees that you, again, don't need advanced mental health training to be able to do, and can have a very significant preventative effect in supporting and ultimately enhancing the ability of that employee to function at their highest level. And then finally, at the tier 3 level, we like to think about these as folks like Mindwell, right? So organizations in the community that are providing intense supports. Med's a great example of that, providing a lot of tier 3 level supports as well, but having a clear pathway from a tier 1 preventative intervention, wellness-based seminar, or other similar preventative interventions through to a tier 3 level via this type of a pyramid can help your organization think about what are the things we should be thinking about, how do we begin to increase that support as an individual member of our team is identifying as needing more and more support, and we can have those at the ready reserve. So just some initial brief thoughts for you all to consider in the beginning of our discussion. I'm going to turn it over now to Dr. Moore, who will be talking a bit more with you all about lifestyle health. In advance of our discussion, maybe in 15 minutes or so, I am very interested in these questions. What is one thing that you could be starting to improve on your own sense of health and wellness within the workplace? And then what's one thing you could be doing on behalf of others within your workplace to change things a bit? We often get great conversation coming out of these questions. So perhaps we can return here in about 15 minutes. Dr. Moore, I'll turn it over to you now and stop my share so that you can start yours.
Okay, well, thank you, Aaron. I appreciate that. So let me go to share screen. We want desktop 2, share, and then I'm going to start my slides. David had said things you weren't hearing very well, but the volume on my mic is high as it goes. So
nope, you're good to go now, Dr. Moore. I can hear you perfectly.
And somehow we got to the wrong slide. So there we go. So thank you. I'm gonna go to a more of a 20 to 40,000 foot level on the healthcare system. And as we're going through this, be thinking about things that Aaron said about how you might integrate some of the concepts that he's presented here. I'm going to be hopefully a congenial provocateur and give you perhaps an alternate view about what really is driving healthcare costs. We're going to talk about how our healthcare system is pretty much unprepared to address those drivers of costs. And then in a theoretical way, what we might do here in Ithaca to address some of this. Now, if you're familiar with the works of Dr. Sean Nicholson at Cornell, I'm going to say he completely hits the nail on the head. But my view today is more like apples and oranges with him, but they're not mutually exclusive. He gave a recent Friday morning conference at CMC that I would highly recommend. Hit the advance button and it didn't advance. Let's try again. There we go. So as Dr. Rickow said, mental health has taken a hit in the pandemic, and this is data from recent data from the CDC on anxiety and depression trends in the US since the pandemic. I won't dwell on that. He did a nice job. In the USA, this is provocative work from Bradley and Taylor, suggesting that part of the problem that we have in America is that we don't spend on social care, and we make up for that in higher healthcare costs compared to other OECD countries shown here. Unfortunately, these are not simple problems to solve. What I'm going to try to do is make the case for lifestyle and social determinants as the underlying causes, then look at how we fail to solve those things today, and then address a complex healthcare market in which, from my perspective, Mindwell is a community-based organization that wants to fit in, but is somewhat of a bystander in many circumstances. Social, behavioral, and economic environmental domains are where health is achieved or not. We've spent decades using polypharmacy, meaning 5 or more prescription medicines, medical devices, and surgeries, sweeping these problems under the rug. But the truth is, medical technology determines about 15% of health outcomes, and it's wildly expensive. Accountable care organizations, or ACOs, and value-based tools primarily push down on the right side of this teeter-totter. And that has always looked like a bad bet to me. And in fact, more and more data shows that ACOs aren't making much of a dent in cost growth. The current fight is about making ACOs take on more financial risk, but I don't think that's going to be any more effective. Way back in '84, when I was a second-year medical student, I was taught the root cause of many healthcare problems are things that we do to ourselves, not bad luck, not bad genes, bad choices. 85 to 88% of health outcomes stem from things we do, or in the case of physical activity, don't do to ourselves. Back to my bad bet. Why would a doctor who has little influence over these driving factors agree to be the one held accountable? That's saying, I don't have any influence over your situation, but I'll take the blame for your financial hit. Really? Our society, unfortunately, condemns itself to expensive healthcare costs beginning at a very young age. Vincent Felitti, who was a family medicine doc for Kaiser Permanente in California, was the first to study what's now known as adverse childhood events. These are the 8 ACEs in his original study, looking at how factors in childhood affect disease during adulthood. By the way, if you're looking at these and thinking about yourself, I'd say not many people have a score of 0. Mine isn't. But don't let your sample size of 1 color your interpretation of the data on the next slide. The more adverse childhood events, the more severe the burden of chronic disease in adulthood. Highest prevalence in this study was almost 20%. The more ACE events you had as a kid, the more likely you are to smoke, the more likely the smoking is to cause emphysema, which is the top right graph, the more likely you are to be alcoholic and to use intravenous drugs. Subsequent studies have revealed this relationship is true for all manner of chronic conditions, obesity, diabetes, heart disease, and so forth. Jumping to adults now, Here's a view of modifiable chronic conditions and risk factors. Of course, some of these adults were exposed to ACEs, but that's not data that was obtained in this study. It shows the relationship between health risk assessment scores and paid claims. These are the expenses for folks who had above average scores on these modifiable risk factors. They spent a lot more money on those people with below average scores. Modifiable factors contributing then to excess costs. Please note the excess costs associated with obesity and inactivity. When you adjust for what's known as population attributable risk, that changes the ratio of expenses. So if a lot of people have a risk factor, even though that risk factor is tiny and raises risk only a little bit, that domain, that risk domain, can dwarf risk factors that only a few people have, even if that second risk factor dramatically increases the risk. So physical inactivity and obesity are the two highest categories of excessive costs in population attributable terms, because 70% of Americans are overweight or obese, and 75% don't meet the recommendations for physical activity, and 25% are completely sedentary. More than that, employers get hit hard by lost productivity due to chronic conditions. Here, the situation is turned a little. Employees with mental and metabolic health problems lose up to 1.5 work days a week because of absenteeism, being paid for not being there, and presenteeism, being paid for being there but not getting anything done. Diabetes, mental health, and chronic disease are especially troublesome. Note that 12 hours a week, I did the math on this, is 15 weeks of annual pay, and that works out exactly to April 15th. I must note that there are abundant data today showing that type 2 diabetes is a direct result of weighing too much and doing too little. If one reduces weight and increases activity enough, type 2 diabetes goes away completely. No medicines, normal glucose metabolism. This has been proven multiple times in a variety of different approaches using diet in multiple ways, as well as bariatric surgery. Lost productivity is actually almost 2.5 times the direct healthcare expenses. Most doctors that I've talked to are unaware of that. Doctors rarely even know who the employer is, who's the buyer of their healthcare services. So in our system, doctors are unaware of the employer's main health-related pain, which is lost productivity. So what can a medical system do about these non-medical factors? John Rugga was the founder of Hudson Health Waters Health Network, which is one of the premier ACOs in New York State. And his evolving view of primary care started here in 1980. You can see the things that he was trained to do. But 2 years ago, this is his view of what primary care has to do. Unfortunately, practices don't get paid for doing much of this work. And it's not what doctors and nurses are trained to do. Internal medicine, 7 years learning to stitch lacerations, deliver babies, intubate someone with respiratory distress, manage cardiac arrest, read x-rays, and on in order to be a resource advocate. In 2020, a study by the healthcare consultancy Merritt Hawkins reported that executives of healthcare systems estimated that PCPs are responsible for generating $2 million per doctor per year, including downstream revenues. Like Aaron says, physicians and the healthcare system are too expensive to do all of this stuff. But our system of primary care practice isn't really paid by the staff to doing this. And in this era of team-based care, that needs to change. And that means including expanding the kinds of people who are providing these services. Complexity in patients' lives is mostly non-medical. We approached it as if we're going to solve these problems with the two icons in the bottom right. But the truth is that literacy, health literacy, family conflicts, low social support, lack of money, unreliable transportation, built environment, and poor access to healthy choices, unhealthy work-life balance, and excessive stress are really the driving causes. So when you have a patient going to a physician who's not well equipped to those kinds of things, the simple solutions don't work. It's easier for the doctors to focus on a metric like the doctors being graded on a blood test called an A1C, which is a measure of diabetes, and not by those things that are driving the costs. When your only tool is a hammer, all of your problems look like nails. Here's the kind of thing America needs, but this is much harder to do. Triage mechanism to lifestyle and social determinant interventions and chronic care management, sometimes using wearables, but it could be exactly as L.E.A.R.N outlined, where you are using MindWell as a health mentor to help people activate, engage in the kinds of resources, community resources that are available for them to do health improvement. Sadly, instead, what we have today is mainly healthcare silos, with each entity serving its own needs. Stakeholders are typically unaware of the other stakeholders' pain points shown in these silos. Community-based organizations, entities like MindWell, are usually left out of the loop, not part of a health plan. Indeed, to give some credit to ACOs, they are, and Cayuga health partners, they are trying to tie the payer and the providers together. So let's imagine a different Ithaca, one that focuses on well care. Surely everyone in this meeting knows that Ithaca is, in my mind, maybe the best place in all of America to address these matters, because we have an enormous number of community-based organizations that can support all of these kinds of issues. When I was director of clinical services at the Cayuga Center for Healthy Living, we tried hard to integrate with many CBOs, but it was not simple, largely because there's no business model aside from goodwill. So what I'm about to say is not intended as criticism of anyone in our community, especially not Cayuga Health Partners, which is doing a darned good job as an ACO. Indeed, I believe Ithaca is a community that could show the rest of America how this can be done. I'm going to pause to let you read this quote from Elinor Ostrom. You likely never heard of Elinor Ostrom. She won the 2009 Nobel Prize in Economics for her work in understanding complex markets. Absorb the title of her acceptance speech: Polycentric Governance of Complex Economic Systems. Her point in this quote is that if the market isn't doing what we think it should do, we need a better understanding of complexity. Rather than pound harder with our hammer, we need to learn how a bolt works. Ostrom used game theory to understand complex decision-making systems. Every player has a characteristic, including choice: PCPs, specialists, nurses, etc. Every player holds a position. Some people move first and other people react to the move. First, the patient sees the primary care doc, who orders a test, which triggers a radiology tech to take an x-ray, which a radiologist must read, and so forth. The set of possible decisions at each node depends on what role that player is playing, and that determines the actions they can take. Not everybody has the same amount of information available to them. In the case of mental health, HIPAA privacy regulations make it difficult for everyone to be on the same page. There are outcomes that actors jointly affect. Make my knee pain and my depression go away requires multiple staff and resources and actions. Sorry, we're still on there. And actors and actions map to final outcomes and costs and benefits. Also, in the 50s, Ostrom realized that some markets don't function in a two-way buyer-seller barter concept. In Ostrom's complex market, stakeholders fall into one of four groups: And they're listed on the base of what she called exclusivity of use versus subtractability of use. So if I make a tee time, you can't make a tee time at the same time on that golf course. If I come in and buy the last pomegranate in Wegmans and you come in after me wanting a pomegranate, you don't get one. So that's the examples of exclusivity versus subtractability of use. I've put them here in categories that she renames as public services, toll services, common pool resources, and private goods and services, and with a view towards things that might be used in weight management in Ithaca. Here's a thought experiment for you. Having served when I was at Hugo Center for Healthy Living, I served on the Parks and Trails committee with the town. So here's the thought. If an employee uses the Black Diamond Trail to exercise and improves health and well-being by doing so, should the health plan make a contribution to the maintenance of the trail? So here's Ithaca. We've got lots of wonderful community resources and employers and a built environment. We have a healthcare system that is shielded from that community to some degree by a privacy. And we have community-based organizations in the community like Mindwell who are wanting to help but need referral of patients, and they need to know why they're being referred to those patients or are being referred to them so that they can then make it helpful for patients to be able to go out and use those community resources that are out there and part of the health plan. Most important, one of our problems is that all the stakeholders in the system work for different entities, each with its own objectives and constraints. If everyone is doing their own thing, we cannot achieve the desired outcomes and payoffs. To improve health behaviors and social determinants, we must decide collectively on outcome domains, scope of effort, who gets credit for which actions. If Mindwell helps the depression scores go down, does the PCP get credit for that? Who might have to give up control over something because another player is better suited to that role? If PCPs are too expensive to do lifestyle counseling, maybe we need health coaches. Most important, we must assign costs, benefits, and the relative value of everybody's contributions. What Eleanor Ostrom was saying is that these factors are either the building blocks of our silos, or they can be the jackhammers that tear the silos down. Addressing the social determinants is a solution to healthcare cost growth. To make that happen for our community, you, employers, are the primary buyers. Unfortunately, small businesses have little voice in the polycentric governance of healthcare because you don't have much say in health plan design, not unless we act in unison, giving voice to small employers as key stakeholders. So with that, as provocative as I can be, I will stop and open up to, stop sharing and open up to conversation. Let's see.
Before we even get started in the convo, I just want to say thank you both. It's really cool to see ideas that I've had about the pandemic and ideas that I've had about the long-lasting impacts around mental health, especially in our youth, to see some analytics and some data and some charts behind all of that, and to start engaging in this conversation about how we fix some of the damage that's been done by the pandemic that's not just fiscal and not just with like business. Our people are always going to be one of our greatest resources. So the fact that you all are doing the work to make sure that we're taking the time to fix people the same way that we have been with small business and business infrastructure is really meaningful. So thank you so much for the work that you guys are doing. It means a lot, and it's really great to see it all laid out in this format.
Thanks for saying that, David. And thank you, Dr. Moore, for those insightful comments that you had. I found them to be fascinating, especially, you know, the bit that you said about ways that we can create alternative pathways to effective mental health care and healthcare. Black Diamond Trail being a great example of that in your talk. So would love to turn it over to our guests here and get any feedback or perspectives or questions answered from Dr. Moore, or myself that you may have. As I mentioned earlier, I'm very interested in hearing from you all about what maybe things you have tried within your organizations to help support the health and wellness of your employees, along the lines of what we've both spoken about today. Who would feel comfortable responding to some of what we've shared this morning or this afternoon to start with?
And also, Dr. Rakow, did you say you were going to put the 2 questions back up that you had earlier as well?
Yeah, I'm happy to. That would be great. Dr. Subin, do you have?
Yeah, I did want to jump in just because this is an area that I'm incredibly excited about. And unfortunately, I'm going to have to jump off soon because I got patients I got to go see. But, you know, I wanted to comment, thank you, Dr. Moore, especially for your review. I felt like I was getting a presentation that's prepping me for my lifestyle medicine board exam next month. So you touched on all the pillars, so I'm pretty excited. Thank you. And Dr. Rakow, you know, I know I chatted with you briefly. You know, one of the important components I'm learning through my lifestyle medicine studies is the importance of developing collaborative partnerships with community resources and really, you know, taking advantage of others' expertise. And, you know, obviously MindWell is that, you know, service for mental health services. So I'm, you know, I can't express my enthusiasm anymore about being in the role that I am as the chief medical officer and hopefully guiding our organization to building those relationships to support our employees and the community as well. So I don't have any specific questions at this point. I just wanted to express my enthusiasm and thank you both for giving this presentation and kind of opening the door for me to understand, you know, just the tip of the iceberg opportunities here in my, you know, in our own community that I can reach out to get this ball rolling, because I think it's critical. If we don't have a healthy health system, it's really difficult to take care of our community. And with the what's happened over the past year and a half and the burnout that is prevalent amongst the providers, you know, we really got to focus some efforts on them to take care of themselves as well, or they can't take care of their patients. So again, I just want to thank you both. Very helpful. I look forward to speaking with both of you separately from this conversation. And sorry, but I got to jump off and get to see some patients. So thank you again, and have a great day. And I look forward to talking to both of you.
Thank you. Thank you very
Forward,
much.
thank
We'll talk soon.
Thank you for the compliment.
Thank you for being
Look
here,
forward and,
Dr. Subin.
I'll see you before, I'll talk with you before your exam, but good luck. Actually, the ACLM meeting is coming up. And so
Yeah, great. Thank
we're
you.
pretty close with, we know Sue Benegas pretty well. So we're, anyway, good. Maybe I'll see you at the meeting.
Yeah, thank you. Great.
Okay.
Take care.
Something that I would like to challenge people to do, because we will have a lot of people that will be watching this video after today, as we put it up on the Chamber's website. I would like for people to maybe take these 2 questions back to their staff or into their staff meeting, or present it to your supervisor, or if you are the employer, maybe find a way to present this to your staff and have them answer these questions. I think that they're 2 really good questions. Dr. Rakow, you're the one that's presenting this on behalf of MindWell. Did you want to read those out again? I know you have.
Sure. Just very simply, what's one new thing that you could be doing to start to improve your own sense of health or wellness? There are a lot of things that have been on our to-do list. I should be starting that soon. I'm just going to give it one more week. I'm busy now. I'll do it next month. But let's just get concrete and let's get simple here. Let's not overthink this. What's one new thing that you could do to better take care of yourself, given that every single one of us is under a higher level of stress now than we were under 12 or 18 months ago, period. Secondly, how do we take care of each other in the workplace, in other settings in which we find ourselves in every day? What could you be doing if you're a leader in your organization, if you are an individual that is interested in seeing organizational change occur, to support and on behalf of those colleagues of yours to advance health and wellness within your place of work or within the organization that you represent? There are lots of ways that you could do this. So no idea here is a bad one. But if you do have questions on what those ideas look like, or if your idea, how to implement it potentially, let's talk about that. And we are available for those additional comments and questions offline.
Awesome. And as we get ready to wrap up here, I think that's a really great segue. Do you want to talk about a little bit about Dr. Moore, Dr. Raykow, ways that people can contact you, or if they would like some maybe additional presentations for their staff, more individualized based around what their needs are? Is that something that Mindwell offers, or do you have some recommendations of things you can plug people into, Dr. Moore?
Sure. I'm sharing my email address here so that everybody can have that. Actually, and they could get it. You're free to share it, David, if they contact you. I would, just in general, I would say that the pandemic has really emphasized, I think, the challenge of work-life balance that L.E.A.R.N recommended. And some people was able to make it better, but many people were able to make it worse. And I would, one of the challenges in the United States and in our capitalist business world is there's a lot of pressure that really is about work on the work side of the work-life balance. And for us in my organization, that came this week because somebody wanted our help with and participation in a grant proposal due tomorrow, and they came to us last Friday afternoon. So we had less than 7 days to help them put stuff together. And I was like, really? But that creates dramatic work-life balance, and it's surely in the healthcare system. That's really a difficult thing to overcome because one thing you experience in the hospital is it just takes one crisis to really you take your schedule and wreck it, and then you're behind, and everything seems to then fall into crisis management, and that's a real problem we have in healthcare, and I don't think anybody has ever solved it, but for sure we need to work on how do you do that, and how do you improve your sense of health-life balance.
I wholeheartedly agree with that. In our final minute or two here, just to add additional resources to the conversation, these are important resources for any employer to have ready access to: the Suicide Prevention Lifeline, Crisis Text Line, National Domestic Violence Hotline, Sexual Assault Hotline, Alcoholism and Drug Dependence Hope Line, amongst many others that are available on Mindwell's website, as well as many other websites out there within the mental health space. So please make sure that these oftentimes are the best preventative line of support that you could offer, and having ready access to these for your organization. My contact information is here, aaron@mindwellcenter.com. To start working with us, mindwellcenter.com/get started. But for just general questions and continue conversation around what we've discussed today and started discussing today, please do reach out to me. Please do reach out to Dr. Moore. We're here to help you and to talk through some of these issues in greater detail. You're not alone. We are here as a community to collectively lift what is this immense weight around health and wellness of our community and society in this very challenging time that we find ourselves in. So thank you again to Dr. Moore and to David and to the entire chamber for sponsoring this, as well as Tompkins Trust. And we look forward to being in touch with everyone.
So David, if I can have one last, I'm going to put it back on you, pal.
Okay.
Because you're a good man. But I think if there's one thing I've suggested, then it's very provocative at the end of my presentation, is that small businesses can act in unison. And that, one thing I was very happy that Dr. Subin was on, because I think what we need, we've seen this before here in Ithaca with Cornell and the health systems, which is everybody working together to create a communal health plan that works for all the businesses in the community, so that the healthcare system knows how to approach care for everybody, and the businesses are able to articulate, these are the things that we're experiencing and that we need your help with. and that these are the community-based organizations like MindWell, like Gadabout, like all kinds of Meals on Wheels and other sorts of community resources to help folks so that we can begin to address this problem as a community. We have to come together. And if anybody can do that and bring everyone together, it's you, David.
Well, you know what? I actually really like that idea. I think you have sparked a little something in me. And I think with amazing partners like you and Dr. Ray-Cal and the connections that we have here at the Chamber, I do think it's highly plausible and something that we definitely can do and kick off and create kind of like a mental health and healthy living task force here in town and partner with some small business. And, maybe I'll pull some strings and see if we can get some dollars thrown at this, because we all know it takes money to make things like this happen. But I think that creating it with the idea is definitely a good starting point, Dr. Moore.
If it can happen in any town, this is the town.
This is the town.
Absolutely.
I agree. So we'll talk more offline about it. I think that I have two really good allies here for us to get started, and got some good connections. I can make some calls to some people. So stay tuned for that. For everybody that's checking out this video, that may be something big coming our way to Tompkins County and here in Ithaca in 2022. So with that said, I want to thank you all for being here. Again, thank you to our sponsor, Tompkins Trust Company, Dr. Ray-Cal at the MindWell Center, and to Dr. Moore. You guys are very appreciated. Continue to keep up the good work that you're doing here in our community. And we'll see you guys at the next Learn session. Thank you all for joining us, and enjoy the rest of your day.
Thank you, David. Thank you. Bye-bye.
Okay.